Hi everybody, my name is Molly Dowd and I'm one of the district nurses with Walnut Creek School District. Kathy Shalin, the other district nurse, and I have created this presentation for you today. The objectives of this presentation are to discuss the protocols and procedures we've put into place to make sure that reopening of schools goes on smoothly and safely. Today we'll be going over the Return to Learn 4.0 website, the COVID-19 dashboard, the COVID-19 home self-screening tool, face coverings, physical distancing and hand washing, cleaning and disinfecting, health room procedure, contact tracing, staff COVID-19 testing, mental health, and health conditions. Even though COVID-19 has now been going on for a while, we wanted to refresh on some definitions. So COVID-19 is an illness that's caused by a virus that can spread from person to person through respiratory droplets. The virus that causes COVID-19 is a new kind of coronavirus. There have actually been a lot of coronaviruses that have been around, and this is a novel coronavirus that has spread globally. COVID-19 stands for Coronavirus 2019. This is the Return to Learn 4.0 website. If you go to the Health and Safety Protocols tab, then you will gain access to all of these icons, and everything that we will be going over today is available here, so you do have this resource available for you. Walnut Creek School District COVID-19 dashboard. This is also available on the Return to Learn 4.0 website, and it shows the total confirmed positive COVID-19 cases for our employees. However, we did want to note that Walnut Creek School District is only counting positive confirmed cases for individuals who have been on campus and within close contact of others, which means if someone tested positive but didn't come onto campus and didn't come into contact with any other individuals, they would not be counted on this dashboard, so that is something to note. The student home screening tool. So prior to arriving onto campus, you will perform a home screening for your student, and students must stay home if they exhibit one or more symptoms of COVID-19. This home screening tool is not submitted anywhere. It is just something that you look over prior to bringing your child to campus. You should notify the attendance office that your student is not coming to school, and we are counting on your honesty to keep our school environment safe for staff and students. So it's really important that if your student is exhibiting one or more symptoms of COVID, to make sure that they stay home. So this is what the home health screening tool looks like. It is also available on the Return to Learn 4.0 website. It will ask if your student is experiencing one or more of these symptoms within the past 24 hours, and if these symptoms are new or unexplained by any other reason. So a fever of 100.4 or above, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. It's important to note that we do have the caveat at the beginning that these symptoms are new or unexplained. So for example, if your student does have a history of asthma and you know that they're just experiencing their normal asthma symptoms, it would still be okay to send them to school. We also ask, within the last 14 days, has your student been within close contact of someone who is confirmed positive with a COVID-19 diagnosis? Or within the last 14 days, has your student tested positive for COVID-19, or are you waiting for the results of a COVID-19 test? If you answered yes to any of those questions, then we have instructions for how to proceed at the bottom. We also have community COVID-19 testing available, so Walnut Creek School District is pleased to be working with Agile Force in association with PNH Laboratory to offer voluntary on-site COVID-19 testing at no cost to parents and students. It will be available every Wednesday from 8 a.m. to 4 p.m., and the location is at our Tice Creek school site, which is 1847 Newell Avenue in Walnut Creek. And it is located in the off-campus portables. The test will be a RT or PCR test through a viral nasal swab, and or antibody testing is also available. We also wanted to talk about Contra Costa Health Services resources, so they also have COVID-19 testing available by appointment. And if for some reason the community testing that we have available is not fitting your time schedule, they have lots of different appointment times that you can use, and they have different locations that you can go to. And this is drive-up testing. So even though it might seem like it's the end of the flu season, sometimes flu season can actually start in late February and really ramp up by March. So it is still very important to get your flu shot during this pandemic. On the left side of the screen, you can see Contra Costa Health Services locations where you can get your flu shot. and this is for free. There are also locations that Kaiser has for you to get your flu shot. However, their Walnut Creek office does not offer flu shots at this time, so you have to go to their Dublin or Martinez medical offices, and they also have drive-up flu shots. Face coverings. So face coverings will be required by all staff and students. We wanted to go over proper mask maintenance, so it's important to handle the mask by the loops, and the mask must cover the nose and the mouth. It's important to replace masks that are soiled, have holes, or do not fit, and to store the mask in a clean place where it will not get dirty. Cleaning hands before handling the mask is important, and also laundering the mask after each day of use in warm water. Students will be excluded from campus if they are not wearing a face covering. We do have face coverings available at school should your student forget to bring their mask, but it really is important to remember to bring the mask before stepping onto campus. Physical distancing. Physical distancing will be enforced while at school. Chairs will be situated 6 feet apart in classrooms, and any group activities must be completed while maintaining physical distancing. We wanted to go over the definition of a contact. So that is when someone who was within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. So that's why we are making sure that physical distancing is taking place while on campus. And 6 feet is basically about 2 arms length. This is what a typical classroom will look like. So all desks will be situated at least 6 feet apart to maintain that physical distancing. They will also have plexiglass on them, and students will be organized into stable groups with smaller class sizes as well. Hand washing. Hand washing is still incredibly important to stopping the chance of infection. So students are encouraged to wash their hands and use hand sanitizer as much as possible, but especially after touching what is considered a high contact surface. So a high contact surface is basically any object that multiple people could be touching throughout the day. Some examples are doorknobs or light switches. And students will always clean their hands before and after eating, after using the restroom, after coming into the classroom from outside as well. And teachers will supervise and encourage this hand washing. Hand washing stations are also available throughout campus to encourage consistent hand washing. It's important that hand washing is done with soap and water for at least 20 seconds, and to get in between the fingers and underneath the fingernails because germs definitely like to hide there. One way to make sure that you're washing your hands for 20 seconds is to sing the happy birthday song twice in your head. So teachers will have access to a designated spray bottle with cleaning solution for as-needed spot cleaning while they are in the classroom. Walnut Creek School District has a strict cleaning schedule, and each learning space will be sanitized between uses. Highly touched surfaces will be disinfected throughout the day by custodial staff, which again includes those door handles, desks, phones, light switches, and faucets. On the upper right-hand corner of the screen, you can see our maintenance checklist, which kind of just gives you an idea of how thorough our sanitation and cleaning processes are and the different locations where we clean. On the bottom right of the screen, you can see the disinfectant that we will mainly be using, and this is the disinfectant that teachers will have access to. It's the 730 HP disinfectant cleaner. The active ingredient is hydrogen peroxide. It is List N, which means it's EPA approved to disinfect COVID-19, and it has a COVID-19 kill time of 1 minute. So after being on a surface for 1 minute, then it has been confirmed to kill COVID-19. Health room procedure. So students showing COVID-19 symptoms at school will be sent to the health room immediately for assessment to keep them separated from others. If COVID-19 symptoms have been identified as present, then staff will call parents who must pick up their child within 45 minutes. We do have nurses that will be staffing our health rooms, so they will be able to assess the student for COVID-19 symptoms. Again, if the student has a chronic condition such as asthma that may be mistaken for COVID-19 symptoms, they will be able to assess for that and send them back to the classroom if their symptoms are normal. However, they will be calling parents if it is possible that their symptoms are related to COVID-19. If you are unable to come pick up your student within 45 minutes, you must designate someone who will be able to do that. And then parents will be encouraged to get their student tested. If the student is not tested, they have to stay out of school for 10 days and monitor symptoms for 14 days. If the student tests positive, they will also have to stay out of school for 10 days, and the district nurses, Kathy and I, will conduct contact tracing. All individuals who came into direct contact with a positive individual will have to stay out of school and quarantine for 10 days. This is the health room send home letter. So it basically goes through the instructions and the recommendations that you contact your healthcare provider and get your student tested. It also gives instructions for if your student tests negative or if they test positive, and goes over the COVID-19 symptoms again. Contact tracing. So when a positive case has been identified, we will conduct contact tracing to identify anyone who is considered a contact. You will be notified if your student has been identified as a contact of a positive case, and all contacts will be required to quarantine for 10 days and monitor symptoms for 14 days. Testing is recommended, although even with a negative test, you must stay out of school for 10 days. The reason for this is that if you came into contact with a COVID positive person, if you get tested and it comes back negative, it could be that the virus has not replicated in your body enough for you to get a positive result, which is why we still have to wait that 10-day time period before you're allowed to come back. If your student is a contact and becomes symptomatic, again, we recommend your student gets tested, but also it's important that you contact your child's healthcare provider. We also communicate all positive cases to Contra Costa Health Services Department, and they conduct their own contact tracing within their department. All of our protocol that we have created has come from Contra Costa Health Services guidelines as well. So this letter will be sent to you if your student has been identified as a contact of a COVID-19 positive case. It basically goes through the quarantine day period, the COVID-19 symptoms, and explains that Contra Costa Health Services will likely be contacting you as well, as they do their own contact tracing that goes further out into the community. Staff are also being tested on a weekly basis, and this will help us identify cases of asymptomatic staff members, which will allow us to conduct contact tracing and quarantine exposed individuals. If your student's teacher is identified as COVID-19 positive, it is possible and likely that your student will be identified as a contact and therefore will have to quarantine for 10 days. So we wanted to end the presentation talking about wellness because mental health has definitely been affected by for a lot of people by the pandemic, and it is something that needs to be destigmatized. So we wanted to first go over Zoom fatigue. We're all feeling it. Zoom makes communication more difficult and causes an unconscious overworking of the brain. But there are some tips to help reduce Zoom fatigue. So being mindful of the environment where your child participates in their Zoom sessions, establishing a routine and sticking with it, scheduling movement and sensory breaks, and making a sensory toolbox to use during Zoom sessions. So this could be something like a fidget spinner or even like a toy that they could be playing with. And then also getting outside and going for a walk, a hike, or a bike ride, making sure that they're moving their larger skeletal muscles is great, especially after they've been sitting and looking at a computer all day. Increased screen time can also cause eye fatigue and other eye issues, so there are techniques to help your child practice good eye habits. The 20-20-20 rule is available as well when using a computer or other screen device, which basically means just looking away every 20 minutes from the screen for at least 20 seconds and focusing on something that's around 20 feet away. Adjusting the lighting is important to eliminate glare on the screen, and if you're sitting in an area where sunlight is streaming in, making sure that your screen is not reflecting that sunlight, so getting into a different position is important there as well. And having your child spend time outdoors when possible, exposure to natural light is critical to developing eyes. Nutrition. So healthy eating has many benefits for children. It stabilizes energy, it improves cognitive function, evens out mood, helps maintain healthy weight, prevent chronic diseases, and can prevent many mental health conditions as well. If you go to a website called MyPlate, it can tell you what kind of things that you'll need to incorporate into your diet at each meal. And especially during this time when you're sitting around the house a lot and boredom can lead to snacking and overeating. So it's important to maintain a healthy diet. And making sure that you're buying snacks that are basically, not as processed and better for your child are very important as well. So exercising during COVID-19. Getting exercising is more important than ever. Not only does it have physical health benefits, but also mental health and cognitive benefits. And the CDC recommends around 60 minutes of exercise a day. So exercise that increases the heart rate is great. So cardio exercise such as running, biking, hiking, dancing, or even something like balloon volleyball. Building muscle through climbing or push-ups, and then strengthening bones, so using those big joints, and that can be done through jumping rope or gymnastics. Now, 60 minutes does seem daunting, like a long period of time that your child needs to be exercising, but there's little ways that you can incorporate this into your schedule, and you'd be surprised how fast you get up to that 60-minute mark by just adding little things. Sleep is very important for health and school performance. It can affect mood, motivation, what your child's eating, how they're interacting with their family and friends, and sleep deprivation has a significant impact on mental health as well. The recommended sleep is 10 to 13 hours for ages 3 to 5, 9 to 12 hours for ages 9 to 12, and 8 to 10 hours for ages 13 to 18. Some tips to make sure that you're maintaining the sleep schedule is to establish a routine, stick to a bedtime, avoiding screens especially right before bed, and creating a good sleep environment. We also wanted to discuss a COVID-19 support group that is available through the Contra Costa Crisis Center. It is now accepting participants, and the support group topics include understanding stressors, coping strategies, strength and sharing, COVID and grief, and also embracing humor. If you don't want to join this COVID-19 support group, but you are really still struggling and would like to talk to somebody, you can call their phone line as they're a great option and a great resource. So we wanted to end with a health conditions reminder. So office managers and district nurses are still needing all the documentation if you have a student with a health condition. Please contact either the office managers of your school site or the district nurses, so Kathy or I, if you have a student with a health condition that may require accommodations or medication while on campus. Once this documentation is submitted, you can drop off the student's medications to the office, as office managers will be there to accept them at this time. So I wanted to give you both Kathy and I's contact information. We are available for you if you have any questions, and we really do want you to reach out to us. So we are a resource available to you. Thank you so much for listening to this presentation. Again, reach out to us with any questions, and I hope you have a great day.